Now, care home workers who test positive but have no symptoms should be allowed to carry on working. That's according to one care home group boss.
Tony Stein, who runs about 60 care homes across England, says that they're actually really struggling now with staff self-isolating, and that puts a huge pressure on residents and, of course, other employees.
Well, it comes as more than 20 hospital trusts have declared critical incidents because of staff shortages. Our West Midlands reporter Balvinder Sidhu has been to meet him, sent this report.
Today I'm at the headquarters of a care home management company which employs around 2,300 workers and has 60 sites across England. Now, around 178 of those workers are self-isolating. Joining me is the CEO, Tony Stein, who says that this is causing huge disruption for the business. Tony, thank you so much for joining me. Can you just tell me, what impact are the self-isolation rules having, first of all, on your business?
OK, well, there are a number of impacts. Firstly, on our residents, because every day we have to risk assess the staffing shortage issues. We have to determine whether or not we can safely admit any further residents to our services. We have to determine whether or not we can offer the same level of service to the residents that are in the homes. And of course, by having staff absent, isolating, we are then worried about the pressure we're putting onto an already tired and exhausted workforce that have been working very hard for the last 2 years to manage coronavirus. The existing staff that we have in the homes are having to work extra shifts, are having to cover different roles, and the managers of those services are having to spend an inordinate amount of time making sure that we've properly staffed and we're safely staffing those services. So, it has a drain on management, but it also has a real impact on the remaining staff in the services.
So what's the solution? Because I think you've said that you think they should be allowed to go to work if they're asymptomatic and they test positive. Isn't that a controversial statement to make when we're trying to protect the NHS and reduce the spread of the virus?
In our services, all of our staff by law are mandated now to be vaccinated. So since November, every single member of staff has had two vaccines. We've got a very large number of them that have been boosted, and that's growing by the day. All of our residents are vaccinated and boosted. And of course, a care home is a very different environment to the general public spaces that you see. All the staff are well trained in infection control. And we can wear PPE, and we're very used to managing infection. So, the risks are very, very, very low. But my worry is that if during this mild spread of Omicron, we don't change the way that we behave, then when a potentially more aggressive variant comes out, we'll be back to lockdown, and we won't have taken advantage of the opportunities for our residents to be visited by their loved ones and for our staff to get a little bit of respite. The reality is, though, that it's still a very transmissible disease and people still need to be vaccinated and boosted. I can't emphasise that enough. But I make the point that in our situation in care homes, all of the staff and all of the people we support are vaccinated and boosted. But we should also be treating the situation within care homes slightly differently. And by that I mean shortening the isolation period or even getting rid of it altogether.